Hello everyone, and welcome back to the channel. Today we're tackling a topic that many find a bit embarrassing but is incredibly important: bad breath, or as it's known medically, halitosis. It's more than just an awkward social problem. Sometimes it can be a sign of something more serious. So, let's dive deep. Separate fact from fiction, and give you the tools you need for lasting fresh breath. First things first, what actually causes bad breath? Most of us immediately think of that garlic bread we had for lunch or maybe the morning coffee. And yes, certain foods and drinks are definitely culprits. But the number one cause, in about 90% of cases, originates right inside your mouth. It's all about bacteria. Our mouths are home to millions of bacteria that feed on leftover food particles. As they break down these particles, they release smelly compounds called volatile sulfur compounds. That's the classic bad breath smell. This is why your daily oral hygiene routine is non-negotiable. Brushing twice a day for at least 2 minutes is the foundation. But are you brushing correctly? You need to clean all surfaces of your teeth, the outside, the inside, and the chewing surfaces. And don't forget your tongue. A huge amount of bacteria lives on the surface of your tongue, so using a tongue scraper, or even just your toothbrush to gently clean it, can make a massive difference. Flossing is also crucial. A toothbrush can't reach the tight spaces between your teeth, where food gets trapped and bacteria throw a party. Now, let's bust some common myths. Myth number 1. Mouthwash is a cure for bad breath. Well, not exactly. Many over-the-counter mouthwashes just mask the odor with a strong minty scent for a short while. It's like using air freshener in a room with a full trash can. It doesn't solve the underlying problem. For a real solution, look for an antiseptic or therapeutic mouthwash that actually kills the bacteria responsible for the smell. But even then, it's a supplement too, not a replacement for brushing and flossing. Myth number 2. If you don't smell your own breath, it must be fine. Unfortunately, we can become accustomed to our own scents, a phenomenon known as sensory adaptation. You might be completely unaware of how your breath smells to others. A quick, though not perfectly accurate, test is to lick the inside of your wrist, let it dry for a few seconds, and then smell it. This gives you a better idea of what's going on. Another major cause of bad breath that often gets overlooked is a dry mouth, or xerostomia. Saliva is your mouth's natural cleaning agent. It washes away food particles and neutralizes acids produced by bacteria. When your mouth is dry, bacteria can multiply rapidly. This can be caused by certain medications, medical conditions, or even just breathing through your mouth while you sleep. The solution? Stay hydrated. Sipping water throughout the day is one of the simplest and most effective ways to keep your mouth moist and your breath fresher. Chewing sugar-free gum or sucking on sugar-free candies can also stimulate saliva production. So, we've covered the basics: brush, floss, clean your tongue, and stay hydrated. These are the cornerstones of fresh breath. But what if you're doing all of this and the problem persists? This is when it is time to consider that your bad breath might be a red flag for a deeper health issue. Persistent bad breath, especially when paired with excellent oral hygiene, can be a symptom of gum disease like gingivitis or periodontitis. These conditions are caused by plaque buildup and can lead to serious damage to your gums and jawbone if left untreated. Beyond the mouth, chronic bad breath can also be linked to other medical conditions. For instance, sinus infections, tonsillitis, or even acid reflux can cause odors that manifest as bad breath. In rarer cases, a specific type of breath odor can be a sign of systemic diseases. For example, a fruity smell can be associated with diabetes, while a fishy smell could indicate kidney problems. This isn't meant to scare you, but to empower you. Your body often gives you signals when something is wrong, and your breath can be one of those signals. So, when should you see a professional? If your bad breath doesn't go away after a couple of weeks of improving your oral hygiene routine, it's time to book an appointment with your dentist. They can do a thorough cleaning, check for signs of gum disease or cavities, and rule out any oral health issues. If your dentist gives your mouth a clean bill of health but the bad breath continues, your next stop should be your primary care physician. They can help investigate if there's an underlying medical condition that needs to be addressed. Let's recap the action plan for conquering bad breath for good. Step 1. Master your oral hygiene. Brush for 2 minutes, twice a day. Floss daily, no excuses. And don't forget to clean your tongue. Step 2. Hydrate, hydrate, hydrate. Drink plenty of water to prevent dry mouth. Consider sugar-free gum to stimulate saliva. Step 3. Be mindful of your diet. While you don't have to give up garlic and onions forever, be aware of their effects. Step 4. Don't ignore persistent issues. If the problem doesn't resolve, seek professional help from your dentist or doctor. Living with bad breath can affect your confidence and your interactions with others, but it's a problem with a solution. It's all about creating good habits that support your overall health. Thank you so much for watching today. I hope you found this information helpful and feel more equipped to tackle this common issue. Look, a truly healthy mouth is about more than just brushing. If you've been struggling with stubborn bad breath or just want a deeper, more profound sense of cleanliness, I highly recommend trying the all-natural solution I've been raving about. This isn't just another mint or mouthwash. It's a powerful probiotic supplement that targets the root cause of many oral issues, the imbalance of bacteria in your mouth. Think of it as a complete reset for your oral environment. You deserve to feel confident in every conversation. I've put a special link for you right below the video. Go ahead and click the link in the description or the pinned comment to see the incredible science behind this formula and secure your discounted pack. Take control of your oral health and boost your confidence. Click that link now. If you learned something new, please give this video a thumbs up and consider subscribing to the channel for more health and wellness tips. Don't forget to hit that notification bell so you never miss an update. Stay healthy, stay fresh, and I'll see you in the next video.